There's a moment every cat owner knows. You're sitting on the couch and your cat jumps up beside you. Not because they want anything, not because it's feeding time, just because they chose to be near you. And for a second you think, do I actually know this animal? Do I really understand what they need, what they feel, what's happening inside that little body right now? If you've ever had that thought, this video is for you. Because here's the truth. Most cat content never tells you. Your cat is a completely different creature at 8 weeks old than they are at 8 years old, and different again at 15. The food that's perfect for a kitten can quietly damage an adult cat's kidneys over time. The behavior that's adorable at 4 months is a serious red flag at 4 years. And the signs that your senior cat is in pain? Most owners miss them entirely. Not because they don't care, but because nobody ever showed them what to look for. Today, we're fixing that. This is the Complete Cat Life Stages Guide. We're going from the very first weeks of a kitten's life all the way through the senior years, covering nutrition, behavior, health, and the decisions that actually matter at each stage. Not generic advice, not feed them good food and take them to the vet. Real, specific, science-backed information that changes how you care for your cat. And I want to be upfront with you. This video is long, intentionally long, because your cat deserves more than a 5-minute overview. This is the kind of guide you save, come back to, and share with every cat owner you know. Whether you just brought home your first kitten, you're navigating the complicated middle years with an adult cat, or you're watching your senior companion start to slow down, there's something in here that will change how you see them. Let's start at the very beginning. The kitten years, birth to 12 months. Picture this, a tiny kitten, eyes still sealed shut, weighing less than a stick of butter. No vision, no coordination, barely any ability to regulate their own body temperature. And yet, everything that cat will ever become, their personality, their attachment style, their ability to trust humans, their resilience under stress, is already being shaped right now in these first weeks. This is the part most new kitten owners don't fully appreciate, because kittens are so irresistibly cute that it's easy to treat the early weeks as just a waiting period before the real relationship begins. But the science says something very different. The decisions made and the experiences had in the first 12 months of a cat's life create a biological blueprint that shapes everything that follows. So let's walk through it, week by week, stage by stage. The first 2 weeks, the neonatal period. Newborn kittens are more helpless than almost any other domestic animal. They're born with their eyes and ear canals sealed shut. They can't walk. They can't regulate their body temperature. They can't even eliminate waste on their own. Their mother has to stimulate them by licking their abdomen after every feeding. Without her, or without a human caregiver replicating those functions, a newborn kitten cannot survive. Body temperature is the first critical factor. A newborn kitten's normal body temperature is between 95 and 99 degrees Fahrenheit, significantly lower than an adult cat's 100 to 102.5 degrees. And unlike adult cats, they have almost no ability to generate their own heat. If the ambient temperature drops, their body temperature drops with it. Hypothermia in neonatal kittens can set in within minutes, not hours. This is why orphaned or rejected newborns need a heat source at all times, a heating pad on the lowest setting under half the bedding, so they can move away from the heat if needed. Never over a full surface, never without an escape route. Feeding in the neonatal period is every 2 to 3 hours. Around the clock, orphaned kittens need kitten milk replacer. Not cow's milk, not human baby formula, not oat milk, not anything you'd find in a regular grocery store. Cow's milk and most human milk alternatives contain lactose in concentrations that kittens cannot digest, and feeding them these alternatives causes diarrhea severe enough to be fatal within days. Kitten milk replacer is specifically formulated to match the nutritional composition of cat milk, and it's available at most pet stores and online. If you find yourself with an orphaned newborn at 2 in the morning and you can't get KMR immediately, plain whole goat milk is the closest emergency substitute. Not ideal, but far less harmful than cow's milk. Feeding technique matters enormously. Kittens fed from a bottle must be positioned belly down, never on their back the way you'd hold a human baby. On their back, they can aspirate milk into their lungs, which causes aspiration pneumonia, often fatal in animals this small. Belly down, with the bottle angled so they have to work slightly for the milk, mimics the natural nursing position and dramatically reduces this risk. After every feeding, gently stimulate the kitten's genital area with a warm, damp cotton ball or cloth for 30 to 60 seconds. This replicates what their mother would do, and it's not optional. Without stimulation, kittens this young simply cannot eliminate on their own. Now, here's something that surprises a lot of people. Even during these first 2 weeks, when kittens can't see or hear yet, they are already learning. Not in the conscious way we think of learning, but at a neurological level. The quality of handling they receive, gentle or rough, warm or cold, consistent or unpredictable, is already shaping their stress response systems. Kittens handled gently for short periods each day during the first 2 weeks show measurably lower stress hormones, faster neurological development, and better social behavior later in life compared to kittens who received no handling. You are literally helping build their nervous system every time you hold them carefully. Weeks 2 through 7, the socialization window. Around day 10 to 14, something remarkable happens. The eyes begin to open, not fully. They start as thin slits and gradually widen over the following week. The ear canals open around the same time. And suddenly, a kitten who existed in a world of warmth, smell, and touch has an entirely new flood of sensory information arriving all at once. This marks the beginning of what behavioral scientists call the socialization period. And it is, without any exaggeration, the single most important developmental window in a cat's entire life. Here's what's happening neurologically. Between approximately 2 and 7 weeks of age, a kitten's brain is in a state of extraordinary plasticity. New neural connections are forming at a rate that will never be matched again. The brain is essentially asking a question. What is normal? What is safe? What belongs in my world? And whatever the answer is during this window becomes the foundation for the cat's entire future relationship with the world. Kittens exposed to gentle handling by multiple different humans during this window grow up to be comfortable with people, including strangers, including children, including men with deep voices, and women with high voices, and people wearing hats, and people in glasses. Kittens not exposed to humans during this window can develop a fear of people that is almost impossible to reverse later. This isn't a training failure. It's not a personality flaw. It's a neurological reality. The window closes, and what wasn't wired in during that period simply doesn't wire in the same way afterward. The same principle applies to other animals. Kittens socialized with dogs during this window are dramatically more likely to live comfortably with dogs as adults. Kittens socialized with other cats form social bonds more easily. Kittens exposed to normal household sounds, vacuum cleaners, televisions, children playing, doorbells, develop into cats who aren't sent into a panic by those sounds for the rest of their lives. So what does this mean practically? If you have a kitten between 2 and 7 weeks old, your job, your most important job, is controlled, gentle exposure. Handle them daily but gently and for short periods. Introduce different people. Let them hear the sounds of your home. Don't overwhelm them. The goal is positive exposure, not flooding. If a kitten shows signs of distress, back off and try again later. The socialization window is forgiving. You don't have to do everything in one day. You just have to do something every day. And here's the part that breaks a lot of hearts when people learn it too late. Kittens adopted before 7 weeks, which unfortunately still happens. Sometimes from well-meaning people who think the sooner the better, and miss critical social learning that only happens between litter mates and their mother. Kittens learn bite inhibition, play rules, how to read feline body language, and how to lose gracefully in a play fight from their siblings and mother. Kittens taken away too early often become adults who bite too hard, who play too rough, who misread social cues from other cats. The minimum ethical adoption age is 8 weeks. Many cat behaviorists argue for 12 weeks for optimal social development. This is not an arbitrary rule. It's biology. Weeks 8 through 12, the new home period. This is the moment most people's kitten story actually begins, the day the kitten comes home. And it's worth being honest about something. From the kitten's perspective, this is one of the most disorienting experiences of their life. They have just been removed from everything familiar. Their mother's scent, their siblings' warmth, the specific sounds and smells of the place they were born. And they've been placed in an entirely new environment, with entirely new people, new smells, new sounds, new surfaces underfoot. Even for a well-socialized kitten, this is a significant stress event. The instinct for most new owners is to do too much, too fast. Show the kitten every room. Introduce them to every family member. Let the kids hold them. Bring them to meet the dog, all on day 1. And the result is a kitten who spends the first 2 weeks hiding under the bed, which then triggers panic in the new owners who worry something is wrong. Here's the better approach. Start small. Set up a single room as the kitten's base camp. A bathroom or a spare bedroom works perfectly. This room should have everything they need: food, water, litter box, a hiding spot, a few toys, and something that smells like you. Let them explore and master this one space before expanding their territory. This isn't confining them. It's giving them control, which is the foundation of a cat's sense of security. A cat who feels in control of their environment is a cat who will come out from under the bed. Over the first week, spend time in that room with the kitten. Sit on the floor, get down to their level. Let them approach you. Resist the urge to pick them up constantly. Read a book in there. Work on your laptop. Just be present without demanding interaction. You are teaching them through your behavior that you are predictable, that you don't lunge, that you don't overwhelm, that being near you is safe. This is how trust is built with a cat, not through force or flooding, but through patient, consistent presence. The litter box in the new home deserves its own conversation, because litter box problems that start in kittenhood often persist for life, and most of them are entirely preventable. The box should be in a quiet, low-traffic area, not next to the washing machine, not in a busy hallway, not in a location where the kitten might be startled while using it, because a cat who gets frightened during litter box use will often stop using the box entirely. The box should be large enough for the kitten to turn around comfortably. And as they grow, the box needs to grow with them. Covered boxes might seem like a good idea for odor control, but many cats dislike them because they trap smells inside, which is aversive to an animal with a sense of smell 14 times more sensitive than ours. Start with an open box, and only switch to covered if the cat demonstrates a preference. The vaccination schedule. What you actually need to know. Let's talk about vaccines, because this is an area where misinformation is genuinely dangerous, and where a lot of well-meaning cat owners make decisions that put their cats at serious risk. The Core Kitten Vaccine series covers feline herpes virus, feline calicivirus, and feline panleukopenia, together called the FVRCP vaccine, or sometimes just the distemper vaccine, despite having nothing to do with canine. Distemper. These 3 diseases are serious. Feline panleukopenia in particular has a mortality rate in unvaccinated kittens that can exceed 90%. The vaccine is not optional. It is not a lifestyle choice. It is the difference between a kitten who survives and one who doesn't. The series starts at 8 weeks, with boosters at 12 weeks and 16 weeks. The reason for multiple doses isn't redundancy. It's because kittens are born with maternal antibodies that they receive through their mother's colostrum. And these antibodies, while protective early on, also interfere with vaccine response. As the maternal antibodies wane over the first weeks of life, the kitten becomes vulnerable to disease, but also newly capable of mounting their own immune response to vaccination. The series of 3 shots is designed to catch the kitten at the right window, because we can't know exactly when each individual kitten's maternal antibodies will wane. Rabies vaccination is required by law in most of the United States, regardless of whether your cat is indoor only. Bats, the primary rabies vector, can and do enter homes. An indoor cat who encounters a bat they found inside your house can be exposed. The vaccine protects your cat, and because rabies is invariably fatal in humans and transmitted through bites, it protects you. The question of additional vaccines, feline leukemia, bordetella, feline infectious peritonitis, depends on your cat's specific risk factors and lifestyle, and is a conversation to have with your veterinarian rather than a decision to make based on a YouTube video. What I will say is this: please don't skip the core series. The risks of the diseases they prevent are real, documented, and devastating. The risks of the vaccines themselves are minimal. Spaying and neutering, timing, and why it matters. This is a topic that generates more debate than it probably should. So let me be clear about what the science actually says. The traditional, recommendation for spaying and neutering was 6 months. This came from a practical place. 6 months is generally before the first heat cycle in females and before sexual maturity in males, so it prevented unwanted pregnancies. But in recent years, research has gotten more nuanced, particularly for certain breeds and sizes, and the conversation has evolved. For average-sized domestic cats, which is the overwhelming majority of pet cats, spaying or neutering between 4 and 6 months remains the standard recommendation, and the benefits are substantial. In females, spaying before the first heat cycle reduces the lifetime risk of mammary cancer by approximately 91%. After the first heat, the protection drops significantly. After the second heat, the protective effect is much smaller. Spaying also eliminates the risk of pyometra, a potentially fatal uterine infection that affects a significant percentage of intact females by middle age, and that requires emergency surgery to treat. In males, neutering eliminates testicular cancer, dramatically reduces the risk of certain prostate problems, and this matters for indoor cats, virtually eliminates urine spraying behavior, which is not just unpleasant, but extremely difficult to eliminate once it becomes established. Intact male cats also roam, fight, and are at dramatically higher risk of FIV, feline immunodeficiency virus, which is transmitted through bite wounds. The argument against early spay/neuter is primarily about orthopedic development. Some research in dogs suggests that early removal of sex hormones can affect bone and joint development. The evidence in cats is less robust than in dogs, and most veterinary organizations continue to recommend the 4 to 6 month window for average domestic cats. For large or giant breeds, Maine Coons, Ragdolls, Norwegian Forest cats, some vets now recommend waiting until closer to 12 to 18 months. If you have one of these breeds, have that specific conversation with your vet. What is not up for debate? Leaving cats intact and allowing them to breed uncontrolled is a welfare crisis. Millions of cats are euthanized in shelters every year in the United States alone. Every unwanted litter contributes to that number. Spaying and neutering is responsible ownership. Kitten nutrition, the foundation you're building. Here's something that genuinely surprises most cat owners. The nutritional needs of a kitten are dramatically different from those of an adult cat. Not slightly different, dramatically different. And feeding a kitten like an adult cat, or feeding an adult cat like a kitten, creates real health problems. Kittens are in a period of explosive growth. Between birth and 6 months, a kitten's body weight typically increases 4 to 5 times. Their brains are developing, their immune systems are building, their organs are maturing. To fuel all of this, kittens need food that is calorie dense, high in protein, and specifically formulated to support rapid development. Kitten food is not just regular cat food with better marketing. It contains higher levels of protein, fat, and specific nutrients, like DHA for brain development and calcium and phosphorus in the ratios needed for bone formation. Feeding an adult maintenance food to a kitten doesn't cause immediate visible problems. It's a slow, quiet form of nutritional shortfall that becomes apparent over months in things like slower growth, softer bones, a duller coat, or a compromised immune response. Feed kitten food until 12 months of age. At 12 months, transition to an adult formula. Not before, not after. Wet food versus dry food is a conversation worth having at every life stage, but it's especially important with kittens. Cats are obligate carnivores who evolved in desert environments, and their bodies are specifically adapted to meet most of their hydration needs through food rather than through drinking. A wild cat eating a prey diet gets approximately 70% of their water intake from the moisture in their food. Dry kibble contains roughly 10% moisture. Wet food contains 70 to 80% moisture, much closer to what a cat's physiology expects. Kittens fed primarily dry food from the start develop a habit of low water intake that many carry into adulthood, and chronic mild dehydration is a contributing factor in the kidney disease, urinary crystals, and bladder issues that are among the most common health problems in adult cats. Starting kittens on wet food, or a combination of wet and dry, builds better hydration habits from the beginning. If your kitten is resistant to wet food, some are, particularly if they were only offered dry food early in life, try warming it slightly, which intensifies the aroma and makes it more appealing. How much to feed? Kittens up to 6 months should generally be fed multiple small meals throughout the day, 3 to 4 times, daily if possible, because their stomachs are small, but their energy needs are high. From 6 to 12 months, twice daily is usually appropriate. Follow the feeding guidelines on the food packaging as a starting point, but use your eyes and hands to assess body condition. You should be able to feel the ribs but not see them, and there should be a visible waist when viewed from above. A kitten who is visibly ribby needs more food. A kitten who is getting rounded through the belly without visible waist definition may be getting too much. The teenage phase, 4 to 12 months. Nobody warns you about cat adolescence. They tell you about the cute kitten phase and the calm adult phase, and they quietly skip over the months in between when your previously sweet kitten turns into a small furry wrecking ball with boundary issues. From approximately 4 to 12 months, the timing varies by breed and individual. Cats go through a hormonal and behavioral shift that is the direct feline equivalent of human adolescence. If your kitten hasn't been spayed or neutered yet, this is when that becomes very obvious, very fast. But even spayed and neutered cats go through a behavioral adolescence characterized by increased energy, increased boundary testing, and a dramatic uptick in behaviors that were less noticeable when they were smaller. They scratch more. They knock things over with apparent glee. They play more roughly. They push every limit they previously accepted. This is also the phase when many cats are surrendered to shelters, often by first-time owners who feel they got a defective kitten. What they actually got was a completely normal adolescent cat. The behaviors peak around 6 to 9 months and begin to settle as the cat approaches social maturity, which, contrary to what many people believe, doesn't actually happen at 12 months. Social maturity in cats occurs between 18 months and 4 years, depending on the individual. What you see at 12 months is a cat who has moved through adolescence. What you see at 3 years is the cat's actual adult personality. Understanding this timeline changes how you respond to difficult adolescent behavior. If your 8-month-old is clawing the furniture, the answer is not punishment. It's providing better alternatives, redirecting to appropriate scratching surfaces, and understanding that this phase passes. If your 10-month-old is launching ambush attacks on your ankles, the answer is more structured, interactive play with wand toys to burn that predatory energy appropriately, not spraying them with water or scruffing them. The adolescent behaviors are developmentally normal. Your job is to channel them, not suppress them. Mid-checkpoint 1. You're about 20 minutes in, and you've just built the complete picture of the kitten years. From the first fragile days through socialization, the new home transition, vaccination, nutrition, and adolescence. But here's what I want you to hold on to as we move into the adult years. Every single thing that happens in year 1 is still present in year 7, year 10, year 15. The socialization experiences that built your cat's nervous system, the nutritional foundation you laid, the trust you earned by being consistent and patient, the habits, good and problematic, that formed in those early months. Your adult cat is not a different animal from the kitten you raised. They are the same animal, carrying every one of those early experiences forward, which means that everything we're about to cover in the adult years is built on this foundation. And there's one thing in particular about the adult years that almost nobody talks about, a change that happens so gradually that most owners don't notice it until it's already caused a problem. We'll get to that in just a moment. The adult years, 1 to 7 years. Let's be honest about something. The adult years are the phase of cat ownership where most people go on autopilot. The kitten phase has a natural urgency to it. Vaccinations, socialization, spaying or neutering, learning to use the litter box. There's always something to pay attention to, something new happening. And the senior years carry their own weight because you can see the changes, you can feel the shift in your cat's pace and energy. But the adult years look from the outside like maintenance. Your cat eats, sleeps, plays, and seems fine. And so owners assume they are fine. They fall into routines. They skip vet visits. They don't notice the slow changes happening under the surface. This is the phase where the most preventable health problems develop, quietly, gradually, over years. The body composition shift, the problem that starts at 1. Here's the change nobody warns you about. The moment your cat crosses from kitten to adult, roughly the 12-month mark, their caloric needs drop significantly. A kitten, burning energy on growth, bone development, and brain maturation, needs substantially more calories per pound of body weight than an adult cat in maintenance mode. But many owners don't make the switch to adult food at 12 months. Or they make the switch, but keep the same portion sizes. And the cat begins to gain weight. This sounds minor. It isn't. Feline obesity is one of the most serious welfare issues in domestic cats, and it develops in exactly this way. Slowly, from small daily caloric surpluses that accumulate over months and years. A cat eating just 20 extra calories a day, less than a tablespoon of dry food, will gain approximately 1 pound per year. That doesn't sound like much until you consider that 1 pound on a 10-pound cat represents a 10% increase in body weight. The human equivalent would be a 150-pound person gaining 15 pounds a year without noticing. And the consequences of feline obesity are severe and specific. Overweight cats are at dramatically elevated risk for type 2 diabetes, a disease that requires daily insulin injections, careful dietary management, and regular monitoring for the rest of the cat's life. They're at higher risk for hepatic lipidosis, a life-threatening liver condition. Their joints bear additional stress, contributing to arthritis that begins much earlier than it would in a healthy weight cat. Their immune function is compromised. Their lifespan is measurably shorter. How do you assess your cat's weight at home, between vet visits? The body condition score is a simple hands-on assessment. Run your hands along your cat's rib cage. You should be able to feel individual ribs with light pressure. Not see them, but feel them easily without pressing hard. If you have to press firmly to feel ribs, your cat is overweight. If the ribs are prominently visible and easily felt without any pressure, your cat may be underweight. From above, there should be a visible waist, a narrowing between the rib cage and hips. From the side, the abdomen should be slightly tucked, not hanging. A cat who has lost their waist from above, whose belly swings slightly when they walk, and whose ribs require firm pressure to locate, is an overweight cat. The fix is not starvation. Rapid weight loss in cats is genuinely dangerous. It can trigger hepatic lipidosis, the very liver disease we're trying to prevent. Weight loss in cats must be slow and managed, ideally with veterinary guidance, at no more than 1 to 2% of body weight per week. The sustainable solution is accurately measuring portions, switching to a measured diet rather than free feeding, and if dry food is the primary diet, considering a partial switch to wet food, which has fewer calories per cup and higher moisture content. Dental health. The silent epidemic. By age 3, approximately 70% of cats show signs of periodontal disease. By age 5, the majority of cats have dental disease significant enough to cause pain. And yet dental health remains one of the most overlooked aspects of cat care, partly because cats are extraordinarily skilled at hiding pain, and partly because owners simply don't think to look. Here's what periodontal disease actually means in practical terms. Bacteria accumulate on the tooth surface, forming plaque. Plaque hardens into tartar, the yellow-brown buildup you might have noticed on your cat's teeth if you've ever looked. Tartar below the gum line creates chronic bacterial infection. This infection causes the gums to recede, the bone around the tooth root to deteriorate, and eventually the tooth to loosen and fall out, or require extraction. And throughout this entire process, the bacteria from that chronic oral infection are entering the bloodstream with every meal, every time the gums are irritated. Research links chronic dental disease to kidney disease, heart disease, and liver disease in cats. The mouth is not isolated from the rest of the body. The gold standard of feline dental care is daily toothbrushing, with cat-specific toothpaste, never human toothpaste, which contains xylitol and fluoride that are toxic to cats. Daily brushing sounds extreme to most cat owners, but cats can be trained to accept it, especially if started young. Start with just letting your cat lick the toothpaste off your finger. Then introduce a finger brush. Build from there over weeks. The end goal doesn't need to be a perfect 2-minute brush. Even 30 seconds of brushing over the outer tooth surfaces 3 to 4 times a week provides significant benefit compared to no brushing at all. If daily brushing is completely off the table, and for some cats, the battle simply isn't worth the stress it creates, there are alternatives. Dental diets specifically formulated to reduce tartar through mechanical action. Water additives designed to reduce oral bacteria. Dental chews and treats with the Veterinary Oral Health Council seal of acceptance. These are not as effective as brushing, but they are meaningfully better than nothing. And regardless of home dental care, adult cats benefit from professional dental cleanings under anesthesia. How often depends on the individual cat. Some need annual cleanings, some go 2 to 3 years between them. This is another reason regular vet visits matter. Your vet can assess the state of your cat's mouth and give you a timeline appropriate for your specific cat. Reading the stress. Your cat is hiding. Adult cats are masters of appearing fine. This is not a personality quirk. It's an evolutionary survival strategy. In the wild, a cat who appears sick or stressed is a vulnerable target. Hiding weakness is hardwired, which means that by the time a cat's stress or pain is obvious to the human observer, it has typically been building for weeks or months. The subtle signals come first. Changes in routine, sleeping in different spots, eating at slightly different times, drinking more or less water than usual. Grooming changes, over-grooming one specific area, or conversely, a coat that looks slightly less polished than usual. Litter box behavior, going slightly more or less frequently, going outside the box once or twice, and then stopping. These early signals are easy to miss because each one individually seems insignificant. But a cluster of small changes over a few weeks almost always means something. The most commonly missed stress signal in adult cats is what behaviorists call redirected behavior. Behaviors that look like personality quirks, but are actually displacement activities. The cat who suddenly starts chewing plastic bags. The cat who grooms obsessively after any social interaction. The cat who begins waking you up at 3 in the morning by walking on your face. These aren't random, they're communication. The 3 most common stressors in the adult cat years are Changes to routine or environment, social stress with other animals in the home, and pain, particularly chronic low-grade pain from dental disease, arthritis, or internal issues. The difficulty is that all three can produce very similar behavioral changes, which is why veterinary evaluation is always the first step. Before assuming a behavioral problem is psychological, rule out physical causes. A cat who has started eliminating outside the litter box may have a urinary tract infection. A cat who has become suddenly aggressive may be in pain. A cat who has stopped eating their favorite food may have a tooth that hurts. The indoor enrichment imperative. Adult indoor cats face a problem that is genuinely underappreciated: chronic mild understimulation. Indoor cats live longer, safer lives. The data on this is clear and not seriously disputed. But the indoor environment, even a large and comfortable one, does not naturally provide the cognitive and physical stimulation that a cat's brain and body evolved to require. In the wild, cats spend 4 to 6 hours per day engaged in active hunting behavior. They navigate complex three-dimensional environments. They encounter novel stimuli, new smells, new sounds, new textures, on a continuous basis. They make decisions, adapt strategies, solve problems. The domestic indoor cat, in contrast, often has the same environment every day, with food appearing magically in a bowl at predictable times, and the most complex problem they face being how to get onto the counter before you notice. This isn't a criticism of indoor cat ownership. It's a call to intentional enrichment. And the good news is that cats are responsive to relatively small changes that make a big difference to their quality of life. Vertical space is the single highest value enrichment addition you can make to an indoor cat's environment. Cats are built to move vertically. High vantage points provide security, choice, and a sense of territory. A tall cat tree, wall-mounted shelves at cat height, the top of a bookcase, made accessible. These additions cost relatively little and transform the perceived size of a cat's territory. Puzzle feeders and food dispensing toys address the cognitive need that indoor cats are chronically denied. Instead of eating from a bowl, which takes approximately 30 seconds and provides zero cognitive engagement, the cat has to manipulate an object to release food. This engages their problem-solving instincts, slows down eating, and provides mental stimulation that carries over into calmer behavior throughout the day. Start with easy puzzles and work up to more complex ones as your cat's skill develops. Interactive play, actual play, with you actively controlling a wand toy or feather toy, cannot be replaced by solo toys. This is a point worth emphasizing because many busy owners provide plenty of toys but minimal interactive play. Solo toys satisfy a cat's impulse to bat at things. Interactive play, where the prey moves unpredictably, retreats, hides, reappears, engages the full predatory sequence. Stalk, chase, pounce, catch, 2 sessions of 10 to 15 minutes daily of genuine interactive play is one of the most impactful things you can do for your adult cat's mental health, stress levels, and physical condition. The annual vet visit, why it matters more than you think. 1 in 3 cat owners skips annual vet visits for adult cats who seem fine. This is understandable. Cats are famously resistant to car travel and veterinary handling, and if nothing seems wrong, the hassle can feel unjustified. But this reasoning contains a fundamental flaw. By the time something seems wrong with a cat, it has often been wrong for a significant period of time. The annual wellness exam for an adult cat is not primarily about vaccinations, though boosters are typically due on a 3-year cycle for core vaccines after the initial series. The exam is about baseline assessment. Your vet is listening to heart sounds for early murmurs, feeling the abdomen for organ abnormalities, checking the thyroid gland, assessing dental health, weighing your cat and comparing to previous visits, looking at the coat, the eyes, the lymph nodes, running blood work if indicated by age or history. The value of this examination is comparative. A single data point tells you where your cat is today. Multiple data points over years tell you where your cat is going. A gradual increase in blood creatinine levels over 3 annual blood work panels is a kidney disease trajectory that can be intervened in if caught early. The same finding on a single panel, with no prior comparison, just tells you there might be a problem. And by the time it's visible on a single measurement without context, that problem may be significantly advanced. From roughly age 7 onward, and we'll cover this in the senior section, the recommendation shifts to twice-yearly exams. But in the adult years, once per year, every year, is the standard of care. Don't skip it because your cat seems fine. Your cat seeming fine is exactly the circumstance under which early disease is most catchable and most treatable. Mid-checkpoint 2. We're at roughly 40 minutes now, and here's where we stand. You've walked through the kitten years, the socialization window, the vaccination timeline, the nutritional foundation, the adolescent phase, and now you've moved through the adult years, the weight management challenge, the dental health crisis hiding in plain sight, the subtle stress signals most owners miss, the enrichment your indoor cat's brain is quietly craving. The adult years are when most cats are lost to preventable conditions. Dental disease that became systemic before it was addressed, obesity that progressed to diabetes, kidney disease that was years in the making and caught too late to slow meaningfully. But here's the encouraging reality. Everything we've covered is actionable. The annual exam, the accurate portion, measurement, the dental care routine, the vertical space and puzzle feeders. None of this requires a significant investment of money or time. It requires awareness, attention, the decision to see your cat not just as a companion who seems fine, but as a complex biological creature whose health is happening beneath the surface, continuously, whether you're watching or not. In the next section, we're going into the senior years, and I want to give you a moment to prepare because this section is different. This is where the stakes feel highest, where the emotions are most present, and where, if you have a senior cat right now, or if you're watching your adult cat begin to slow, you'll find the most immediately useful information in this entire video. There are 7 things happening in your senior cat's body right now that most owners don't recognize until they've already caused irreversible damage. We're going to go through every single one. The senior years. 7 years, and beyond 7 years old. That's when most veterinary guidelines reclassify a cat as senior. And for many cat owners, that number comes as a surprise because a healthy 7-year-old cat doesn't look old. They don't move old. They don't act old. They still run for the treat bag. They still knock your water glass off the table at 2 in the morning. 7 doesn't feel like the beginning of anything. But inside that 7-year-old body, the biological processes that define aging are already underway. Kidney filtration is beginning to decline. Joint cartilage is starting to show wear. The immune system is becoming slightly less efficient. The thyroid gland is, in some cats, beginning to overfunction in ways that will become apparent in the coming years. None of this is visible from the outside, but it's happening. Understanding the senior years of a cat's life, really understanding them, not in a generic take them to the vet more way, but in a specific physiologically grounded way, is one of the most important things you can do for the cat you've spent years building a relationship with. Because the senior years are not just a slow fade, they are a distinct phase of life with distinct challenges, distinct joys, and distinct needs that are completely different from everything that came before. When does senior actually start? The 7-year threshold is a guideline, not a biological on-switch. Different cats age at very different rates, shaped by genetics, breed, lifetime nutrition, whether they were spayed or neutered, whether they've had significant health events, and frankly, factors we don't yet fully understand. Small cats often age more slowly than large cats. A petite domestic shorthair who has been well-fed, regularly vetted, and kept indoors may not show meaningful signs of aging until 9 or 10 years old. A Maine Coon, whose large body carries more physiological stress, may show the first signs of age-related change at 6 or 7. Persians are prone to early kidney disease. Siamese and related breeds have higher rates of certain cancers. Abyssinians have an elevated risk of early-onset kidney disease through a genetic predisposition to amyloidosis. Your specific cat's breed history matters for understanding their senior trajectory. The more useful framing than a specific age is this: a cat is entering the senior phase when you begin to notice any consistent changes from their individual adult baseline: sleeping more than their usual amount, less interest in high jumps they used to take easily, drinking slightly more water, coat quality that has shifted even slightly. Any of these individual observations, sustained over a few weeks, warrants a vet conversation, not because it necessarily means something serious, but because the senior years reward early attention. The 7 conditions you need to know. There are 7 health conditions that account for the majority of senior cat morbidity and mortality. Knowing what they look like at the early stage, not the late stage, gives you the best possible chance of catching them when intervention still meaningfully matters. Chronic kidney disease. Chronic kidney disease is the single most common cause of death in senior cats. The kidneys filter waste from the bloodstream, regulate fluid balance, produce certain hormones, and perform dozens of other essential functions. And they do this with remarkable resilience. Cats can lose up to 70% of their kidney function before showing any symptoms detectable without blood work. This resilience is the problem. By the time a cat is drinking noticeably more water, urinating more frequently, losing weight despite eating, and showing the dull coat and general malaise that mark advanced kidney disease, the damage is already extensive. The kidney does not regenerate lost tissue. What is lost is lost. But here's what makes kidney disease manageable rather than simply devastating. It progresses slowly. It can be detected in blood work before symptoms appear. And there are meaningful interventions that can slow its progression significantly when started early. A cat diagnosed with early-stage kidney disease at a routine annual exam, before any clinical symptoms, and placed on a kidney-supportive diet with appropriate fluid management and monitoring, can live with stable or slowly progressing disease for years. The same cat diagnosed at late-stage kidney disease, because symptoms finally became visible, has a very different prognosis. The practical takeaway: from age 7 onward, ask your vet to run a kidney panel annually, or twice yearly if early changes are detected. The SDMA test, now available as part of many routine panels, can detect kidney function loss earlier than traditional creatinine measurements. If your senior cat is drinking more water than usual, this is the first thing to investigate. Hyperthyroidism. The thyroid gland regulates metabolism. Some cats, the majority of them over 10 years old, though it can appear earlier. A benign tumor of the thyroid causes it to produce thyroid hormone in excess. The result is a metabolism running too fast. What does this look like? A cat who seems to be losing weight despite eating voraciously. Often, a cat who is eating more than they used to. Increased activity, sometimes to the point of seeming anxious or unsettled. A fast heart rate, occasionally vomiting. The coat may become unkempt because the cat is losing muscle condition faster than they can maintain it. Hyperthyroidism is one of the most treatable conditions in senior cats. Medication, methimazole, taken daily, controls thyroid hormone production and is effective and relatively well tolerated. Radioactive iodine therapy, available at veterinary specialty centers, is a one-time treatment with a very high cure rate. Surgical removal of the affected thyroid lobe is another option. Even a prescription diet low in iodine can manage the condition in some cats who can't tolerate medication. The critical nuance with hyperthyroidism: it can mask concurrent kidney disease. When thyroid levels are high, they artificially elevate blood flow to the kidneys, which can make kidney function appear better on blood work than it actually is. When hyperthyroidism is treated and thyroid levels normalize, kidney disease may become apparent that was previously hidden. This doesn't mean avoiding treatment. It means monitoring kidney values closely after starting hyperthyroid treatment and adjusting the treatment plan if kidney disease emerges. Arthritis. Here is a fact that consistently surprises cat owners. Arthritis is present in approximately 90% of cats over 12 years old, and many cats show significant arthritic change on X-ray by age 7 or 8, and almost none of their owners know it, because cats don't limp the way dogs do. They don't whimper, they adapt. A cat who finds jumping to the counter painful doesn't vocalize. They stop jumping to the counter. A cat whose hips hurt when climbing stairs doesn't complain. They spend more time on one floor. The adaptation is so seamless, so quiet, that owners often interpret it as the cat just slowing down with age, rather than recognizing it as a pain response. The signs of feline arthritis are behavioral: reduced jumping height, no longer reaching surfaces they used to reach easily, reluctance to use stairs, a gait that looks slightly stiff, especially right after waking from sleep, more frequent grooming of specific joints, less engagement with play, reduced grooming of hard-to-reach areas like the lower back and base of tail, because reaching those areas has become painful, a coat that looks unkempt, specifically around the hindquarters. Treatment options have expanded significantly. Veterinary prescribed pain management is available and effective. Joint supplements, specifically omega-3 fatty acids, and in some cases glucosamine and chondroitin, have evidence supporting their use in cats. Environmental modifications make an enormous practical difference. Ramps or steps to reach favorite elevated spots, a litter box with lower entry for cats who struggle to step over a high side, a heated bed that soothes joint stiffness. A newer class of medication, anti-nerve growth factor antibodies, has recently become available for feline pain management and shows promising results for arthritis specifically. If you suspect your senior cat has arthritis, the conversation with your vet is straightforward: a physical exam, possibly X-rays, and a discussion of pain management options. The goal is not to make your cat young again, it's to make them comfortable. Cats in pain who receive appropriate pain management frequently show personality changes that owners describe as remarkable. The cat who had just gotten quieter with age, suddenly playing, seeking interaction, exploring again. They weren't getting quieter because they were old. They were getting quieter because they were in pain. Diabetes, feline diabetes, is almost entirely type 2, the insulin resistance form, and it is very closely linked to obesity and diet. The adult cats most likely to develop diabetes are those who are overweight during the adult years, particularly those fed high-carbohydrate dry food diets. This is one of the reasons the nutritional decisions you make during the adult years have direct consequences in the senior years. The signs of diabetes are recognizable once you know what to look for: dramatic increase in water intake, dramatically increased urination, weight loss despite increased or normal appetite, weakness in the hind legs in some cats, a coat that loses condition despite good nutrition. Diagnosis is by blood and urine glucose measurement. Feline diabetes is manageable, and a significant percentage of cats achieve diabetic remission, meaning their blood glucose normalizes and they no longer need insulin. When caught early, when the underlying obesity is addressed, and when they're switched to a high-protein, low-carbohydrate diet. This is not guaranteed, and some cats require lifelong insulin therapy. But remission rates of 50 to 80% have been reported in cats who receive appropriate dietary management alongside insulin treatment, particularly when diagnosed early. Early detection matters enormously here. Hypertension. High blood pressure in cats, feline hypertension, is almost always secondary to another condition: hyperthyroidism, kidney disease, or occasionally diabetes. It is common enough in senior cats and significant enough in its consequences that blood pressure measurement is now considered a standard part of the senior wellness exam. The consequences of uncontrolled hypertension are severe and often sudden. The organ most vulnerable to blood pressure damage in cats is the eye, specifically the retina. Hypertensive retinopathy can cause retinal detachment and sudden blindness with very little warning. Owners sometimes report that their cat suddenly seems disoriented, is bumping into things, has enlarged or unequal pupils. This is frequently hypertensive blindness, which can in some cases be partially reversed if blood pressure is brought under control quickly, but not if intervention is delayed. Hypertension is treatable. Amlodipine, a medication familiar from human cardiovascular medicine, is effective in cats and generally well tolerated. The treatment is long-term, and blood pressure monitoring is ongoing, but the key is catching it, which means measuring blood pressure regularly in senior cats rather than waiting for the consequences to become visible. Cognitive dysfunction syndrome. It has a clinical name that sounds very medical, but cat owners who have watched their senior cats live through it describe it in more personal terms. Their cat seems lost, confused in familiar spaces, vocalizes, often loudly, often at night, for no apparent reason, forgets where the litter box is, stares at walls, wakes from sleep, and seems for a moment not to know where they are. Feline cognitive dysfunction syndrome is the cat equivalent of dementia. It results from changes in the aging brain, reduced blood flow, accumulation of protein deposits similar to those seen in Alzheimer's disease, oxidative damage to neural tissue. It is common. Estimates suggest that approximately 50% of cats over 15 years old show some signs of cognitive dysfunction. There is no cure, but there are interventions that slow progression and meaningfully improve quality of life. Enrichment, puzzle feeders, interactive play, gentle sensory stimulation, supports cognitive function. Dietary supplements including antioxidants, omega-3 fatty acids, and medium-chain triglycerides have evidence supporting their use in cognitive aging. A medication called selegiline is approved for cognitive dysfunction in some countries. Environmental modifications, nightlights to help a disoriented cat navigate in the dark, keeping furniture arrangements stable so the cat's spatial memory remains valid, maintaining strict routines, reduce the confusion and distress that accompany the condition. The other essential component is not letting guilt or grief lead to avoidance. Cats with cognitive dysfunction need their owners more, not less. Regular calm presence, predictable routines, patience with the nighttime vocalizations, which are distressing for both the cat and the owner, but respond somewhat to the interventions above. The cat is not suffering from a broken relationship with you. They're navigating a changing brain with the resources they have, and your presence is still the most stabilizing force in their world. Cancer is the second leading cause of death in cats after kidney disease, and its incidence increases significantly with age. The most common feline cancers are lymphoma, which can affect the intestinal tract, the mediastinum, chest, and other organs, mammary tumors in unspayed females, oral squamous cell carcinoma, and injection site sarcomas. The signs of cancer are nonspecific, which is part of what makes it challenging. Weight loss, reduced appetite, lethargy, a lump or swelling anywhere on the body that persists or grows, any change in the character of a previously normal stool or urine, difficulty eating, drooling, pawing at the mouth. These warrant immediate oral examination for the squamous cell carcinoma that commonly affects the tongue and tonsils of older cats. Some feline cancers respond well to treatment. Intestinal lymphoma, which is common in older cats, can achieve remission with chemotherapy protocols that are generally well tolerated in cats, who often handle chemotherapy far better than humans do, largely because veterinary oncologists use lower doses that prioritize quality of life over aggressive tumor destruction. Other cancers, oral squamous cell carcinoma in particular, carry a more guarded prognosis even with treatment. The goal in any senior cat cancer diagnosis is quality of life-centered decision-making, This means having honest conversations with your veterinarian and with a veterinary oncologist if one is accessible to you. It means understanding the realistic goals of treatment, cure versus remission versus palliation, and what each pathway looks like in practical daily life for your cat. And it means not making decisions from panic in either direction, neither rushing into aggressive treatment without understanding its burden, nor declining all treatment out of fear of putting your cat through too much without understanding what treatment actually involves. Nutrition in the senior years. Everything changes in the senior years, and nutrition is no exception. Senior cats face a metabolic paradox that many owners don't understand. On one hand, their energy requirements decrease slightly as activity levels decline. On the other hand, their ability to digest and absorb protein decreases significantly, a phenomenon called reduced protein digestibility that is well documented in cats over 12 years old. The result is a cat who needs fewer calories overall, but needs those calories to be highly bioavailable, and specifically needs a higher percentage of high-quality protein to compensate for the reduced efficiency of their digestive system. This is counterintuitive. Many owners, watching their senior cat look less active and thinking about weight control, reach for reduced calorie or light senior foods. But the nutritional priority in senior cats, especially lean senior cats, is not calorie reduction. It's protein quality and digestibility. A senior cat who is losing muscle mass despite eating well is often not getting enough bioavailable protein, not eating too much. The kidney disease complication, high. Protein intake has traditionally been restricted in cats with kidney disease, on the theory that reducing protein reduces the waste products the kidneys must filter. Current research has complicated this picture significantly. Severe protein restriction is now understood to cause muscle wasting that may be more harmful than beneficial in early and moderate kidney disease. And many nephrologists now recommend moderate protein from high-quality sources rather than severe restriction. This is a conversation to have with your specific vet about your specific cat's kidney values. General advice in either direction doesn't serve individual cats well. Hydration becomes even more critical in the senior years. Kidneys that are already working harder to maintain function need adequate fluid to do so. Senior cats, like older humans, often have a reduced sense of thirst. They drink less than their bodies need, particularly if they've been accustomed to dry food their entire lives. Wet food becomes even more strongly recommended in the senior years than at any other life stage. Water fountains, multiple water bowls in accessible locations, slightly warming wet food to enhance its appeal. All of these strategies support the hydration that senior kidneys depend on. Comfort and quality of life. This is the section that's hardest to write, and perhaps the most important. The senior years are when your cat's world gets smaller, not as a failure, as a natural contraction. The cat who used to race through every room of the house now has a few favorite spots. The cat who used to leap to the top of the cat tree now chooses the lower platform. The cat who used to greet you enthusiastically at the door now lifts their head from a nap and goes back to sleep. This contraction is not sadness. It is not depression. It is a cat living appropriately in a body whose energy is finite, spending that energy on what matters most to them. Warmth, proximity to the people they love, the sensory pleasures that are still fully intact, the smell of your skin, the sound of your voice, the warmth of your lap. Your job in the senior years is to meet them where they are. Bring the food to them rather than making them walk to it, if walking has become uncomfortable. Add the ramp to their favorite chair, so the jump isn't necessary. Provide heated beds because their ability to maintain body warmth has decreased. Keep the litter box scrupulously clean, because a senior cat's sense of smell is still fully operational, and a dirty box that they might have tolerated at 2 years old is genuinely aversive at 14. Spend time just being present. Research from veterinary behavior science, some of which you'll find referenced in our emergency first aid guide, linked in the description below, consistently shows that sick and aging cats whose owners provide calm, quiet proximity recover faster, show lower stress hormones, and demonstrate better quality of life than cats, who are left alone to rest. Your presence is not disruptive. Your presence is medicine. The conversations with your vet in the senior years shift in character. They become less about optimization, how to make your cat healthier, and more about quality of life assessment. A question worth asking at every senior wellness exam is, on a scale of good days to bad days, what does my cat's ratio look like? And what should change that calculation? Veterinary hospice and palliative care is an emerging field, and many general practice vets now have training in quality of life assessment tools that can help guide these conversations with more precision than the gut feel approach alone. And when the time comes, if it comes, when the bad days outnumber the good, when your cat's core personality is no longer visible beneath the weight of illness or pain, when the things they loved most are no longer accessible to them, that conversation with your vet is not a failure. It is the final act of care in a relationship that was built from the beginning on your willingness to see your cat clearly and respond to what you saw. For owners navigating the specific challenges of senior and disabled cats, from managing chronic conditions at home to emergency preparedness to knowing when to call the vet, the resource we've built in our Emergency First Aid ebook is designed exactly for this stage of the journey. You'll find the link in the description below. What comes full circle here is what I want you to leave with. You have just spent 2.5 hours learning about a living creature who will never be able to tell you in words what they need, who will never say, "I'm in pain," or "I'm lonely," or "the litter box hurts my hips," or "I'm scared," who communicates entirely through behavior, through body language, through the subtle shifts that an attentive owner can learn to read, but only if someone teaches them the language. That's what this video was. 4. The kitten who spent the first weeks of their life in your hands, learning that humans are safe. The adult cat who carried those lessons forward through the years, building a life around your routines and your presence. The senior cat who has contracted their world to a few beloved spaces and the warmth of your company, still there, still aware, still in relationship with you in every way that matters. Your cat's entire life is a conversation. It started the day they were born, and it continues right now, today, in every behavior you've learned to see differently after watching this video. The question was never whether your cat loves you. The question was whether you know how to love them back in the language they actually speak. Now you do. If this video helped you see your cat differently, share it with someone who shares their life with a cat. Subscribe if you want to keep going deeper. And drop a comment below and tell me, what stage is your cat in right now? And what was the one thing in this video that changed how you see them? I'll see you in the next one.